Slowly. I'm here doing assignment 3 where we had to obtain a stifle joint. I ended up getting one from a cow, so a bovine stifle joint. Here is the first try at getting a stifle joint. As you can tell, there's no articular ends or anything on them, but a nice little diaphysis, so I thought I would keep it to show you guys. So set this guy up like this, with the distal femur on the top and the proximal tibia on the bottom here. And the patella is not attached to it anymore, cut off, fell off sometime during the cutting process, but it sits right up here in the trochlear groove, like so. That. Open it up. Got a couple of different parts of the long bone. This is the epiphysis down here, and the epiphysis tibia here, diaphysis femur, and diaphysis tibia down there. These are the epiphyseal plates, or the growth plates. They are ossified in this one because the animal is mature, but if the animal was growing, it'd be going that way and that way. This is the cortex, or compact bone, very dense. And then we also have cancellous or spongy bone down here, a lot lighter than a compact bone. This is the medullary cavity in here. It's full of yellow bone marrow. In a young animal, it would be red. We've also got the periosteum and the endosteum, which are very thin. They are vascular and innervated. So the periosteum goes around the bone, and the endosteum lines the medullary cavity here. The nutrient foramen up here. It's the hole into the bone, allowing for passway blood vessels, so nutrients and oxygen can come in and wastes can come out. This is no longer intact, but this is our joint capsule around here, filled with synovial fluid, help lubricate the articular surfaces. So this hyaline cartilage here, down here for the articular surfaces. Articular cartilage helps it slide across each other. And our meniscus, which acts as a cushion and absorbs shock, is down here. We've got condyles, which are kind of hard to see with everything going on this bone, but they are in here, and I'll show you on this guy here. So we've got lateral condyle, medial condyle, lateral epicondyle, and medial epicondyle. There. So we've got some ligaments on here. This is a left stifle joint. So this left side here is the lateral surface, which has the lateral collateral ligament running in through here. And on our medial side, got the medial collateral ligament. You can see a little bit better, shiny part. Also the patellar ligament. Because of the way that it's been cut, it is split in half. So we've got some here on this side, as well as you can see kind of down here, going up through here to the top. And on the inside, we have our caudal cruciate ligament and our cranial cruciate ligament. In human medicine, they refer to them as anterior and posterior cruciate ligaments. So the cranial cruciate ligament is responsible for forward stability, and the caudal cruciate ligament is responsible for backward stability. So they work together in that way. Our fibular head on the lateral side of the tibia, down here. That. And our tibial crest, it's got a bit of fat on here. You can feel that in here. So a veterinarian would perform a drawer test to evaluate whether or not the cruciate ligaments are intact. If they are, there shouldn't be any movement while they do that test. If they're ruptured, there will be movement. So we'll pretend, our patella, you find some landmarks to do this. So pretend our patella is still up here. So my hands aren't quite big enough to do it on something this big, but we find our patella, and our patella. We'd find our tibial tuberosity, and where did that guy go? Ooh, and our fibular head's on that side, so I should have done that in a little bit of a different fashion. Let's put this here. Patella, boa, tibial tuberosity, and fibular head, and just a motion like this, checking for cruciate rupture. I think I included everything that I wanted to talk about. This was really cool to do. There's one thing when you're looking at radiographs and you're feeling the outside of an animal, but I really enjoyed doing this. Thank you.